Hi, I'm Amy. I'm going to be your nurse for today. So, I'm here this morning to just teach you activities that will decrease any potential post operative complications. We're going to go through numerous activities, so bear with me. And if you have any questions, don't hesitate to ask. So, the first teaching we're going to learn about is the use of an incentive spirometer. And are you aware of how to use an incentive spirometer? Oh, you don't know how. So since you just got out of surgery, you're a post-op day 3 patient, you're not really moving as much. So by using the incentive spirometer, this will really help keep your lungs healthy overall. It'll help them expand, keep secretions moving, and just keeping the area mobilized. So what we're going to do is I'm just going to help you to a high Fowler's position in bed. And what you're going to do for me is just exhale out slowly and normally. And you're going to put your mouth around the mouthpiece of the incentive spirometer, making sure you're not blocking the mouthpiece with your tongue. So you're going to take a slow, deep breath in for me. And you're going to notice as you take that slow, deep breath in, the pistol is going to go up. And you also have a goal indicator that's going to go up as well. And you want to kind of keep that steady in between the smiley face region. So you're not overdoing your breath and you're also not underdoing it. So as you go up to your desired level, you're going to try to keep the goal indicator steady in between. And once you hit that desired level and you can't breathe in anymore, you're going to hold your breath for 3 to 5 seconds. And then you're going to take the incentive out and just exhale with pursed lips. And you're going to do that a couple times, and then you're going to cough. And if you do feel any dizziness or lightheadedness, try to take slower breaths or take breaks in between each set of breaths. And then you're going to want to do this at least 10 times every 1 to 2 hours. And I see that you inspired up to 2,000. So we're going to have that as your goal to hit 10 times every 1 to 2 hours. So the next activity that we're going to be learning about is called the deep breathe and cough. If you have a chest or an abdominal incision, what we're going to do is that we're going to splint it with a rolled up blanket or a pillow, just so you're not putting too much pressure on your new incision. So we're going to start off with diaphragmatic breathing. So what you do is you take your 2 hands and you place them along the lower rib cage. You want to make sure that the 2 third fingers are touching, so your middle fingers are going to be touching at midline. And what you want to do is you want to take a deep breath in through your nose, and you want to make sure that your rib cage expands as well with that. You're going to hold your breath for 2 to 5 seconds and then exhale completely through your mouth. So just like this. Making sure your chest expands, holding your breath for 2 to 5 seconds, and then exhaling completely. One more time. Now you're going to complete 2 to 3 cycles of this diaphragmatic breathing. And your next breath, you're going to want to lean forward and cough several times. So you're going to breathe in and then cough. You got to make sure that you're leaning forward. And you're going to try to use your muscles from your abdomen, your thighs, and your butt. And if you're too weak to cough, don't worry about it, because what you're going to want to do is just inhale deeply, and you're going to perform 3 to 4 huffs. So huffs, just think about it as you're blowing out a birthday candle. So you're going to be inhaling in. You're going to huff out. And you're going to do this against an open glottis because this will help move secretions forward as well. The final activity that we're going to do are leg exercises. So there's 3 different types. we have ankle circles, ankle pumps, and then leg exercises. So for each of these exercises, you could either be in supine position or you could be up in a chair. I find it best if you're in supine position because it'll be a little bit easier for you. So we're going to start off with ankle circles. So we're just going to start off with your right foot. We'll pretend like this is a foot. We're going to be in dorsiflex position. So that means your toes are pointed towards the ceiling. And what we're going to do is just circle our ankle at least 3 times around, clockwise. Once you do 3 times clockwise, you're going to do 3 times counterclockwise. And then after you do that, you're going to try it with your left foot. Now we're going to be doing ankle pumps. So we're going to start off with both your legs extended towards the ends of the bed. We're going to make sure our toes are pointed until they are in plantar flexion. Plantar flexion is when your toes are just pointed. So you want to make sure those are towards the end of the bed. And what you want to do when your toes are like that, we're just going to pull the toes back until it's in dorsiflexion. And at the same time, you want to press the back of your knee up against the bed. And when you do that, you're gonna feel a pull sensation up against your calf, and you got to make sure that you feel that in order for this to be working effectively. So once again, toes are in pointed plantar flexion. We're gonna pull the toes back until they hit dorsiflexion. At the same time, you want to press the back of your knee up against the bed, making sure you really feel that pulling of the calves. You're going to do that with your right leg, and then we're going to do the same thing on your left leg. Now we're going to learn how to do ankle pumps. You're going to start with both your feet or both your legs extended out, where it's going to be towards the ends of the bed. You want to make sure that your toes are pointed in plantar flexion. Plantar flexion is just your feet towards the end of the bed, pointed. So what you're going to want to do, you're going to want to kind of just pull your toes back to you until it reaches the dorsiflexed position, just like we talked in the last exercise, so dorsiflexed. At the same time, you're going to want to press the back of your knee up against the bed. And what this does is that you're going to feel a pull sensation on your calf. And you really want to feel that in order to know that the exercise is working effectively. So we're going to do that several times. Plantar flexion, pull it back to dorsiflexion. At the same time, making sure that the back of the knee is pressed up against the bed. You feel that pull in your calf. And we're going to do that several times on your right leg. So I would say maybe 3 to 5 times. And then we're going to do it 3 to 5 times again on your left leg. So our last leg exercise we're going to do is actually called leg exercise. So we're going to start off with both our legs extended out towards the end of the bed again. And what we're going to do here, I'll demonstrate. So we're just going to have our leg out. We're going to slowly slide the sole of our foot in until our knee is at a flexed position. And then we're going to slowly extend our leg again until our leg is flat on the bed. So we're going to do that a couple times on our right leg, and then we'll do it a couple times on our left leg as well. So just like that, slide it in until it's in flexion, and then extend it until it is flat on the bed. So you're probably wondering why we just did all these different types of exercises and are probably thinking, how is it going to benefit me? Well, actually, early ambulation right after surgery is very beneficial in so many ways. It helps promote blood flow, promote circulation, and it prevents further complications such as blood clots. And I know you do not want to develop blood clots right after surgery. So even if you're not getting out of bed, partaking in any daily activities, even doing these exercises that I taught you in bed, such as like the ankle circles, the ankle palms, leg exercises, that really will help promote circulation and blood flow overall. So if you have any other questions, concerns, or if you need me to demonstrate anything, don't hesitate to ask.